Well, hi everyone. This is Dr. Schroeder with a little bit of a video review for your exam one that is going to be coming up now this Friday. Now, remember, as I've been saying all along, this class and the test actually really require, and they expect that you will have gone through and that you will have reviewed and read the text. The PowerPoints, and just a review of the PowerPoints, although it will help you to understand some of the concepts, it's not really enough to probably lead you to the correct answer for all of the questions. The chapters that are going to be included are going to include questions out of chapters 2, which is basically just a discussion of mental health and mental illness. Chapter 4, which is the biological implications. Chapter 6, which is legal, and we didn't really cover Chapter 6, but the only questions that are going to be included on this particular test from this chapter are going to be things that we've either discussed in class or that should be pretty basic knowledge for you in the program, things that you've already discussed. For example, questions on confidentiality and patients' rights. There isn't anything that should not be pretty much common nursing knowledge for you at this point. We're going to talk a little bit, or there'll be some questions on the nursing process and QSIN, primarily on prioritizing and identifying priority interventions for specific problems, and several questions on therapeutic communication. The biologic component is going to include some questions on the neurotransmitters, so make sure that you include in your reading a little bit of discussion about what are some of the important things to remember with the neurotransmitters. In reviewing the test, a few terms that you should look out for. We discussed it in class a little bit, but it discusses in your book about resiliency and what is resiliency and the concept of resiliency. Resiliency is a concept that you want to review for this test. There will be a couple of questions that refer back to it. Understand that there are different levels of care, and in your reviewing your chapters on mental health and mental illness, know that primarily, understand what is inpatient care used for. Why do patients go to the hospital versus why are patients treated on an outpatient basis? Some of the questions will require you to be able to answer that question. And again, remember, primarily, think in terms of patients in the hospital are usually there because they have a very severe disorder in the mental illness, usually are unable to care for themselves, and that will help you to guide you to the correct answer there. There are some questions on the diagnostic test to use, the difference between PET scan and a SPECT scan, for example, MRI, EEG. You should know those various diagnostic tests. We talked about the neurotransmitters. Again, going back to basic, basic nursing, know the basic ethical principles. This refers back to Chapter 2 primarily. A little bit in legal, but also know, for example, the definitions for the terms autonomy and beneficence. What does that mean, and how do they concern patients in a psychiatric setting? Several questions focus on the how to handle or how to respond to patients in particular situations, and specifically referring back to what their defense mechanisms are and what are the correct therapeutic responses in a given situation. So review the chapter on therapeutic communication. That's Chapter 9. Again, we discussed it in class, and we've been discussing it really throughout all the lectures. We've touched on it at least a little bit. So you should be able to select the correct answers having to deal with therapeutic communication. And let's see if there's anything else that I need to really point out. No basic terms that we've discussed in class. Affect, remember what affect refers to. Affect basically being the feeling level and how that compares with cognition, and what cognitive level means. Know about the aspects of therapeutic relationships and what are the purposes of the therapeutic relationships, again discussed in class and also covered in the reading. And their test finishes up, or at least there are several questions, some of them having to do with a little bit of the medications that we've discussed. I guess this goes back to the neurobiology and some of the medications or classes of medications that we've discussed. What are some of the important nursing implications in regards to the patient's biology? And in other words, how are some medications, how do they affect the neurotransmitters? And therefore, what are some nursing implications to remember for that? And I think that pretty much covers it. Again, it's my goal here isn't to try to guide you to specific questions or specific answers, but just to kind of give you some parameters about the kind of questions that are going to come up on the exam. It's all multiple choice. I don't believe that we have any select all that apply in this particular exam. 50 questions, 100 points total, 2 points per question. With only one correct answer per question. So I hope that this helps at least a little bit. If you have any questions, feel free to go ahead and let me know. Unless you hear differently, this is going to be a computer test. I'm still working on getting everybody into Canvas. I believe that I'm still missing section 3, so I really need to, hopefully I get some answer back on that. If push comes to shove, in worst case scenario, I might have to go to a paper test, but I really think that I should be able to get everybody into Canvas so that we can go ahead and do it as scheduled as a computer test. So I look forward to seeing you all on Friday. Those of you out in clinical this week, good luck. I know that you're working hard. You have a lot going on with critical care. We're kind of up to speed. Everybody should be in their clinical assignments. I know that there's been some challenges with some of you anyway on the critical care end, as well as to getting you into your clinicals, especially those of you out in the VA. So I wish you all well. I look forward to seeing you on Friday. Let me know if you have any questions, and good luck.